The coronavirus pandemic is having a huge impact on all sectors across the world. At Connected Voice Advocacy, we've adapted the way that we work, and we're committed to continue to deliver the advocacy services to the people who need them and who are entitled to them. We've noticed a significant increase in the referral rates for household home-related advocacy issues, a rise in domestic violence cases, neighbourhood dispute issues, and the need for crisis services like food banks and welfare benefits advice. But we've also seen a decline in referrals for statutory services. Perhaps the hospital staff are focused on emergency services right now, but we've seen a decline in the referrals for serious medical treatments and safeguardings from the hospitals. We've potentially seen a decline in referrals from care homes since they've gone into lockdown. We were concerned about these trends and talked to our colleagues in other advocacy providers across the country. And together with the NDTI, the National Development Team for Individuals, we came up with a myth-busting pack around advocacy issues. Here's a selection of some of the advocacy facts that are behind the myths. The first here is that people are still entitled to an advocate. The right to advocacy has not changed during the pandemic or the new legislation that's been brought around from the Coronavirus Act. We're still accepting referrals under the CARE Act, the Mental Health Act, the Mental Capacity Act, and the Deprivation of Liberty Safeguards. Advocates can still carry out their role. We've made significant changes to the way that our advocates work. They're working from home. They're only doing face-to-face visits where it's absolutely essential, and using PPE to make sure that they're protected and the service users are protected. So the majority of our work is being conducted through video links, through phone calls, through emails, and research. It's a different way of working. It doesn't work for everybody, but it does ensure that people still have access to the services that they need. Statutory advocates have been confirmed as essential key workers in the sector. This means we have the rights. We have rights to travel, to access venues and settings like hospitals and care homes, and we can still ask for information and reports to ensure that we can carry out our work. Early in the pandemic, the government announced news of a new piece of legislation known as the Coronavirus Act. This would give the government and local authorities the ability to change some of the existing duties that apply to them. It's known as easements, and it means that local authorities who've become under too much pressure to deliver their services could relax some of their duties to become powers. In the Northeast and the service areas that we currently work in, no local authorities are under the easements right now. We have noticed that some of the authorities have reduced some of the services that they are delivering, despite taking no easement measures. We must not assume a local authority is going through an easement process, and we have produced template letters to challenge the local authorities where relaxation is happening in an unlawful way. We know that we can check at any time on the CQC website or the local authority website because they must publicly declare when they are in easement. The Mental Health Act remains untouched, and that means that we are still providing the advocacy service to people who are sectioned under the Mental Health Act sections 1, 2 and 3. They still have the rights to challenge their appeal under a tribunal, and these are usually being conducted through a video conference. One of the other myths that's been happening in some areas of the country is that an advocate is no longer needed in the virtual tribunal if a solicitor is present. And we have been able to challenge that at all times. People are entitled to their advocate to be with them in their tribunal. The right to complain about public services, whether that's NHS or local authority, still remains. What we would say is that due to the different way of working within these sectors, that the response may take a bit longer than usual. One area that has been affected in the NHS is the continuing healthcare assessments. They've been suspended during the lockdown. However, if you have an existing case and you want to make an appeal, that will be done within 6 months of the existing decision. Early in the pandemic, in the news, we heard about GPs being encouraged in care homes to make orders around not resuscitating people. The advocacy sector fought against this to ensure that no blanket decisions are ever made, and that a GP considers the individual and their specific needs, consults with family and advocates where necessary. A more recent advocacy fact is that care homes are conducting tests for the virus, and we are fighting in the same way that the decisions to take a test are being done in a person-centred way and not in a blanket way. Blanket decisions go against the principles of person-centred work and the Mental Capacity Act. The government announced a new way of delivering individuals care packages through their direct payments and made it easier for them to use their family members in some situations. This, of course, supports people who are restricting or shielding and restricting the number of people that they have within their household bubble. And this is another way that could support their family members during the crisis too, to provide some income to them. We also have we're working on the advocacy facts continuously as things arise. Some newer issues that have come up is around GPs in care homes can make advanced decisions about the treatment a person can or cannot receive without consulting with them. This is false. Advanced care planning allows plans to be put in place for future care and treatment. It's especially important during the coronavirus pandemic, as it helps people to express what they may want to happen should they contract the disease. Another myth: advocates need to wear full PPE to visit people. This is false. It's down to the advocacy employer. They're responsible for ensuring that an advocate is supplied and trained in the appropriate PPE that they need. The current guidance is that if you're working in a reception or communal area with possible or confirmed cases and you're unable to maintain 2 meters, that you should wear a surgical mask for the session. So the advocacy employer needs to undertake risk assessments for each setting. They need to look at the risks involved to the service user and to the advocate and make sure that the risk assessments and the PPE provision is completely person-centred. Another myth: family members are not allowed to visit loved ones in care homes. So this is partially true. Older people are the highest risk group of catching and dying the coronavirus. Extra steps must be taken to protect this group. These steps include the control of visitors into the care home, and this includes family members. The control of visitors is at the discretion of the care home provider and must reflect the government guidance at all times. We continue to work with our colleagues and raise issues as they appear. We will continue to create the advocacy myth busting and the advocacy facts, and we will put them on the Connected Voice website to keep you informed.